So I am officially 5 days post-op. Oh gosh, 5 days post-op. And yeah, I've been feeling really good. Mostly, all I've noticed is that, you know, my chest feels like really itchy. And I feel like tired really easily. Like I'll go to maybe fill up some, like a glass with water and I'll just be like, whew. I felt a little bit of lightheadedness, but I haven't really been in any pain. I was taking the Tylenol every 4 hours. I started to sort of stop doing that at night as much, and I'd just take one before I went to bed. And like last night, I took one before, like, okay, the night before last night, I took one right before I went to bed, and then when I woke up, and I was fine. And then yesterday, I ended up kind of weaning myself off a little bit, and I ended up taking one at, at 11. And then I didn't take one until 10:30 at night, and I was fine. So then I was like, okay, I'll just like be aware, and if I'm in pain, I'm in enough pain, I will take one. And I haven't been. So I haven't taken any Tylenol since since 10:30 last night, and it's currently around 4 p.m. So I'm coming off of pain meds already on day 5, which is really surprising, but I'm feeling okay. My diet hasn't really been back to normal until yesterday. I would still feel somewhat nauseous after eating, but today I've felt fine with eating. Today the only thing is again, like I've had a bit of a headache and felt a little like dizzy, but it's not bad. And also I felt like a lot of weird sensations in my chest. I felt like some, just like sometimes it feels wet or cold, or like sometimes I have some burning, or like I can feel sort of where the incisions are around my nipples, it'll feel like heavy, or like there's like a lump, but I'm not like touching it with it. It's just like, I feel like a lump of moving, and just like weird things of the nerves kind of coming back together. It's really, yeah, it's not really necessarily painful. Sometimes I feel like some like prickly, so maybe like a little bit painful, but not really, and it's not bad at all. Yeah, and mostly just like I see my chest in the mirror, like wearing a shirt, and I'm like, whoa, and it's just, I have such a sense of relief, and like, you know, this has happened. It's nothing's gonna be like, oh, you're not gonna actually have top surgery because it's already happened, and I just feel a lot of relief around that, and just like no one can take this away from me, so that's kind of cool, and I just feel really happy. There's still part of it that hasn't completely sunk in, but like it's really starting to, and I'm really starting to feel like really like, wow, like it's over, you know? It's great. Like the fight to get it's over. It's still, a recovery is still happening. Also, yesterday we took off the bandage. My mom and I took off, like, there was like a gauze padding over everything. So I had the ace bandage, and then I had this gauze padding, and then I had little covers on my nipples and covers, like steri strips, on my incisions. And so we took that off yesterday, and except for the stuff covering my nipples and my incisions. So I got to see a little bit, and it was a little bit bloody. You kind of see through the padding on my nipples and the incisions that there was a little bit of blood, but it looked dry, and they looked really good. And there wasn't too much bruising or swelling. There was like a little bit, but it wasn't too bad. When I saw the incision, like when I looked down, I didn't get to see my chest for very long because I felt extremely like nauseous, and like I started to have black spots in my vision and like feeling really dizzy. So I like sat down, and I ended up going, and once we got the bandage back on, I ended up taking gravel and lying down for a bit, and I felt fine. But yeah, I think my body just kind of freaked out a little bit, but I was fine, and I was really happy to see it, but just, I think part of my brain was like, what is happening? So yeah. And another thing is I did have a slight leak around one of my incisions. My mom was slightly worried that one of the stitches blew, but it could be fine, and it's probably not a big deal. Apparently it was just like a little bit of like a little tiny bit of leakage from the band-aid, but it wasn't bad. She put a tissue over top of it when she was wrapping the ace bandage back up, but it doesn't hurt more, and it's fine. Yeah, so then we just took the pad, like the big gauze bandage off, and put the ace bandage back on, because I'll have to wear that for 4 weeks. But we changed the ace bandage with one with Velcro. So we'll see that. And I'll show you in a second what it kind of looks like right now. I think I might need to put on the old ace bandage though, which was had safety pins, just because this one might be a little bit too thin. But it's been feeling fine. I just don't want there to get swelling up here, because the other bandage kind of came up higher. So I've just been trying to ice it every once in a while, as much as possible. Put like big ice packs on it that are like softer, and leave those for a while. They do feel kind of uncomfortable because they're heavy and cold, but it's also kind of nice because I've been really itchy, so it helps with the itching. It also helps prevent swelling, which is important so that the wounds can heal and stuff. But yeah, I've been feeling fine. And then it's been nice to have that bandage off. I feel like lighter, and it's cool. So yeah, and then we'll be able to take off the dressing on my nipples and my incisions. I'm going to see a doctor to do that. My family doctor actually, and maybe go to a wound care center. I don't really know. I'll tell you when I get there, but that will be happening on Wednesday. And then I'll put the ace bandage back on. But and then we might have to change my dressings, but I'm probably pretty sure we'll have to. But yeah, so things have been going really well. I've been feeling really good. And so yeah, coming off the pain meds, I have felt some discomfort and like that prickly sensation, and sort of like a slight pain, or a move and I'll feel like almost like a really tight sort of, it feels sort of lumpy, but almost like a tight sense, especially on my left side, on my nipple and part of my incision. And I just like feels like my brain is just like, stop doing what you're doing. So this is currently the way my chest looks. I have pretty good movement. I was actually able to wash my own hair yesterday, which is awesome, and like sit in a bath, wash my lower body. But yeah, see, I can kind of reach behind my own head, my arms up, like this probably. Like I start to feel some tenseness now. It's not necessarily painful, it just feels tense, and I have a sign to stop. I can reach across, that's probably that's kind of the limits. And then I can also put my hands behind my back. But I want to take it easy again with that and stretching out. I can stretch out like that, but going any further, like I start to feel some tenseness. But and that's hard there. But I'm pretty good. And so what we have here is we have ace bandage, and then these are the nipple pads. You can kind of see them. This should probably be higher up though. Ooh, weird sensation. So that it's kind of bracing the swelling here too. But yeah, and then I had a rash, I think, from the tape of the last bandage, and then I also think that is partially because of shaving rash, because I had to shave because that's something my surgeon requires. And I also had some underarm burn. I had some razor burn in my armpits too, which hurt the first few days, but it's mostly gone now. I'm trying to wash my armpits with cloths every day, keep deodorant up, keep cleanliness, but you can cleanliness. Anyways, so these are you can see where my nipples are, kind of where there's like padding over top of them. And then my incisions, I can kind of feel them if I touch them. They're here. So that's my one incision. And then my other one, ooh, I feel some tightness going here. So can't really feel this one. It's harder. I think there's a thicker layer, but I'm pretty sure it's like here-ish. We'll see. But yeah, so we just have this bandage already. Like, it's already really flat. And like I have the ace bandage on it, but like, you know, it's there's the little thing from the incision there, but it's already super flat and I'm just really happy. Just, it's pretty cool. Yep. It is still hard for me to lift heavy things, especially if the things are like above, like I can't really grab them, but like, you know, I can lift stuff and grab stuff kind of that is like glasses. Oh, this has water in it. I'm trying to really hydrate, but like something like this is empty, but it's still kind of heavy, and it's kind of harder to put far away. But like something up here, like it's heavy, like I can't really. I'm still trying to lift lighter things, and I really feel like a tenseness and like a don't do this if I'm lifting anything like heavy in front of me, especially if I'm straining. All right, goodbye. Thanks for watching.